rank the clinical form that I uploaded under my clinical content, 3 pages, um, and I'll give you the rest of this stuff in clinical. So we'll all meet at 8 a.m. in the main lobby. That runs.
So if you are scheduled for your first rotation for PCCU, you won't have clinical Thursday, right? Because you have clinical every Tuesday only. So you guys are off the hook for Thursday. And then Dr. Sayre, if you're going with her on Thursday,
you'll just go to, so you go up the elevator to general and go to 7 South, and you'll just set like kind of in that little lobby area outside of 7 South, and then we'll go in and tour the unit, and we'll go over all the paperwork.
what time do you land there?
Oh, yeah, probably better for 8 a.m.
Okay. 8. No, it's 8. 8 for OB and 8. So everybody's 8. Everybody's 8. 8, 8, 8.
Orientation.
And because you guys get to sleep in Thursday. So that's the schedule for Thursday. And then on Monday, Ms. Hackney can tell you what she got on Tuesday for PCCU. Okay, so clinical, just going to say a few brief things about clinical. Hopefully you've had time to look at your clinical schedule and know what group you're in, know where you start, and how your rotations are going to go. Remember I said you had at least 6 days, which is basically 3 weeks in each rotation. And the last rotation, I think, has 7 days, so that was a little bit longer. So that's a nice long time to get oriented and adjusted to the unit and actually spend enough time there to kind of enjoy it. So it's about half mid-surg and about half specialty, being peds and OB or the specialty. Typically, except on maybe orientation day, usually we'll all go in around 7 a.m. Or 6:45, depending on who you're with. And it'll either be a 6-hour clinical twice a week or a 12-hour clinical once a week. So now, obviously, during these COVID times, if you get up on Tuesday and you have a 12-hour clinical, and you're symptomatic, you can't go. However, that is a really it's a 2 clinical day miss. So it's a lot. So you'll need to remember that your makeup assignment is going to be much larger because it's 2 days. It's a 12-hour shift instead of a 6-hour shift, so you're going to have a bigger, you only go once a week, you have a much bigger makeup assignment to make. We don't have the ability to do makeup days. Typically in the past we've had so many students we couldn't, but now we don't have anywhere else really for you to go. We're all doing clinical at the same time, so there's really no way for you to make anything up because we're all, there's no way to do an extra clinical, because we're all running clinical at the same time. So every Tuesday and Thursday, the only thing I could think of, possibly, and it just popped in my head, so we could talk about this, is if you had a 12-hour clinical on Tuesday, and for some reason you were able to come back by Thursday, maybe theoretically you might be able to make something up. That'd be the only thing I can think of, and I don't even know if there are any hinges of that I haven't thought of yet. But for the most part, we just don't have the ability to make it up. So we really, unless you have symptoms that are COVID related, you need to be at clinical. And of course, there are penalties for being absent as well, unless it's COVID related. So clinicals are very important. It's where you apply what you learn in class. For some of you guys, for Peds and OB, it's your only opportunity to be exposed to some of these. I know some of you, probably for OB, everybody either loves or hates OB. There's usually no in between. So for some of you, you're like, oh, I don't care if I miss OB, that's fine. But really, whether you hate it or love it, you're still going to see it on your HESI, you're still going to see it on your NCLEX, you're still going to be exposed, you still need to be exposure to it. So we want you to get the opportunity to see all the different areas of clinical focus that we have. So definitely want to be there. You'll have different paperwork for each rotation. Dr. Sayre has her own paperwork. Ms. Hackney has hers, some for PCCU, and then something different for PEDS, and then myself for OB as well. So you will have a clinical assignment pretty much every day that you're in clinical. And that's probably something you had the second semester. That's probably no different. So you'll have an assignment, and you'll have to complete that assignment whenever your instructor says to do the next time. And I remember I said yesterday, some like me will probably say I want to turn it in on paper, and some will want it uploaded. So you'll just again have to go with whatever your clinical instructor wants you to do. We don't accept late work, period. End of discussion. We do not accept late work. So make sure your work is done. It's not excessive. I don't think it's anything that's unreasonable. If you come in, oh my gosh, I forgot to print it out. I left it in my kitchen. Yeah. I don't have anything to say to you. You know, we don't accept late work for any reason. So make sure you've got your clinical work. It may be the instructor will say, well, if you email to me, I do not accept it. You know, but usually other than that, you know, if you don't have your work turned in, you will get a 0, period. So don't, you know, forget it. We're training you guys to be nurses, and we can't afford to forget things. You know, we talked yesterday about math, and we talked about, you know, how important that was. And again, it seems like, oh, it's just math. What if it's Ms. Crazy and I were talking about this yesterday. You know, what if I just put the decimal point in the wrong place? Can't you accept that? Decimal points in the wrong place kill people. I mean, that's the bottom line. So, you know, what we're doing, it may be just math, but it correlates to giving medications to people, not forgetting to give medications to people, not forgetting to do things that patients need. So, you know, that's really what we're working towards, is what we're training you. We're training you guys to be proficient, astute nurses. So, you know, that's why we have the rules that we have. And that may seem harsh, but it's not without reason behind it. So, guys, anything else I need to add? Anything else? I think we went over most things yesterday that are classroom related, but I was trying to think of anything else clinical related that I've left off. Do you all have questions about anything that I maybe haven't covered yet? I'm going to briefly just talk about your uniforms and things, and you know, we'll be, of course, assessing that in individual clinicals as well. But make sure that when you come to clinical, your uniform is clean, that you know, it doesn't look like you slept in it for 3 nights. And I'm not saying you have to iron that your uniform have press it necessarily, but it needs to look clean and tidy and not wrinkled. And I have on occasion seen students that literally look like they slept in their car with the uniform on for the past 3 days. And so we'd like for it to be nice and clean. Your shoes need to be white or gray. That's our policy. And jewelry should be a wedding ring and, you know, post earrings, and that's it. No other jewelry. Take all your other jewelry off if you have piercings. Well, in these days that we're wearing masks, I guess if you have piercings, we don't see them. But technically, we say no piercings except for, you know, 1 on each ear. But I know sometimes at post conference when students read, I'll see their little nose ring, and I'll think, oh, they're just wearing it. Well, they've been wearing a mask all day, so nobody knows it's there. So jewelry, make sure you take all your jewelry off. If you want to wear something under your uniform shirt, it needs to be white. Okay, if you want to wear if you're cold and you don't want to wear a warm-up jacket like this, which you can wear a warm-up jacket if you want to buy one from the department store, you can. Or if you want to wear something under your uniform, it needs to be white. Like
and the reason she says that is because, especially for me, I experienced a student, I didn't even see it until he turned his back to me. Because you guys have white, you know, jacket, and his shirt underneath that, or no, it was a white shirt, but it said a-hole. And I said, you gotta go kind of flip your shirt inside out. So,
yeah, just a plain, solid white shirt, no print and writing. And you know, again, no, I know that some students were confused. I don't think it's too often in this class. We're allowed to wear black or red or green. We were told we were. That's for coming here to school. When you come here in your polos, we're very relaxed about that. If you want to wear a black long sleeve shirt under your polo, we don't care about that. And we don't really want you to wear your nursing shoes here to school because they're dirty. Same goes just for school. You know, or clinical, they've been in the hospital, so you don't need to wear it here. But when you're in the hospital, we want you to look professional. So all white under your uniform shirt, you wear it. So. Oh yes, thank you. Fingernail polish. We all love fingernail polish, but for the semester it needs to be removed. Yeah, so much. And your ladies and gentlemen, your nails need to be clipped short, hygiene, and no nail polish. Piercing.
Care about the color.
Yeah, hair. Yeah, and your hair needs to be. If of leaning forward and their hair falling in their face. So pull your hair back if it can be pulled back, and do that. Not, sometimes I have students that'll wait and they'll wait and see if I'm going to tell them to first. So pull it back when I tell them to, but they'll wait and see if I'm going to tell them to first. Pull it back before we get to clinical. It needs to be pulled back out of your face. So those are our policies. Now, do you see every nurse run around the hospital to follow all those policies? No. Should they? Yes. And I will tell you that CAMC follow, that most of they have similar policies, but they don't always follow it. It's not always enforced. But I can't enforce their policies. Well, I can only enforce ours. So we'll enforce the policies. Okay. Any questions about dress policy or anything else like that? We think we're going to have a great semester. I know you guys are a small class, but we're kind of excited about that because we feel like that, it's a small number. We feel like in clinical it's going to be great that you are going to get to see more, do more. Anytime that there's this lower student instructor ratio, that's good. I mean, that's a nice thing. Do we want more students? Yes, by all means, we want more students. But we're going to enjoy this low ratio while we've got it and enjoy the interaction that we get to have with you guys as lower student faculty ratios. So I think it's going to be nice, especially in OB when we're trying to get really see things. Yes, ma'am.
Just out of curiosity, what was your normal class size?
We've been running 40s in the third semester, anywhere from 40 to 50. The highest I've ever had is 72. I had 72 one semester. But I will say that it was in the fall, and when we first started the LPN, the advanced placement for LPN program, and we had a summer group and a spring group and a summer group that were feeding into the third semester, so there were like 20. So instead of 52, which is what we normally had, we had 72. I think we ended up with 69 or something. That was the hugest class ever. But normally it's been in the 40s. I think last semester was 39 or 40, which is a little on the low side, but we've been mid-40s. And that's kind of been our so I'm not sure how your all's class got so small exactly, but it's okay. It is what it is. And hopefully in the future we'll have larger classes. It just happens to be. I really think that COVID played, you all kind of started right as COVID was starting, and I think that scared a lot of people off nursing school, so that may be a part of it. And we did not have an advanced placement class last semester either. That normally would feed into this class, and normally you'd have anywhere from 4 to 10 students feed into your class from as LPNs from advanced placement, because they have a transition course and then they feed into the third semester. So we didn't have a class last semester either, so that again you might have anywhere from 4 to 10 more. Okay, if you don't have any other clinical based questions, we'll go ahead and get started. And the earlier we get started, the earlier we get done. Again, half of you are going to be doing hands-on practice, and half of you are going to be with me, and then we'll flip-flop. So there's 26 of you, so we're going to send 13 out there. If you guys finish and I'm not done, just let me know you're done, and I'll try to speed up and get done as soon as I can. It usually takes me an hour, 15 minutes to do this, so hopefully you'll that's right. So I'm just going to kind of count off. Well, we're just going to go 1, 2, 1, 2. If you're 1, you're going to stay with me. If you're 2, you're going to go out and do practice. Okay? 1 stays with me. You can leave your stuff in here if you want. You don't have to have it with you. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2.
Yeah, I know. I already forgot which one. I think she said you 2 goes.
1, 2, 1. Okay. If you're a 1, stay with me.
Okay.
If you're 2,